Hello, Pewaukee School District community. This is your superintendent, Mike Cady, reaching out with our plan for reopening in the fall. So what I'm going to do is share my screen and I'm going to walk you through an overview of our plan. Included in the message that you received at home are links directly back to our webpage, our PSD Stay Safe to Stay Open webpage, which has substantial detail, including plans for each and every school. So again, the purpose of this presentation is to provide you with a little bit of a higher level overview, hit some of the main topics that we anticipate people having significant questions about, to provide a little verbal explanation of those items, and then direct you back to the web page for specific detail. There's also opportunities to reach out to specific individuals depending on questions that you may have. And so we'll talk a little bit about that. But without further ado, I'm going to jump into the presentation so that we can share it with you. So the graphic on the right-hand side references the pandemic plan that we have for our school district. This was actually developed years ago when I believe it was when the bird flu was circulating internationally, and school districts were recommended to develop plans in case a pandemic were to ever happen. And as we all know too well, that has taken place here. We started referencing this plan probably last January, February, as news of COVID-19 started to emerge. And so we began planning and preparing. We were moved to really that alert standby with heightened awareness as cases started to make their way to the United States. And then, as we all know, on Friday the 13th in this past March, schools were closed. At the time, we were thinking it would be temporary, but it was for the remainder of the school year. So we worked hard then under that closure to meet the needs of students and families. And since school ended on June 5th, our focus has been on level 4. How do we recover and reopen our schools for the fall? So this has been a daily effort by many members of our leadership team who've really put in countless hours to try to put in a plan to allow us, as the slide says here, to stay safe, to stay open. And that's a slogan you'll hear with the county as well. Some of you may have caught a press conference today in the news that I attended with other superintendents in Waukesha County. We've had a very strong partnership with our county executive, his head of health services, and his team as we've tried to develop plans that make sense so that we can work to return kids to school. All right, so the agenda for this presentation is to provide a number of things. We're going to look a little bit at background and planning and the feedback process that we've engaged in to date. I want to restate the values that are really guiding our decision making as we really try to make these very important decisions for families and for students. The timeline that we are working with, what we've accomplished so far, and what lies ahead for all of us. I'm going to talk about the two options that exist in our plan and explain those to you. I will cover elements of our safety and virus mitigation strategies that we're building in to make our schools safer for our students and for our staff. I'll address some of the frequently asked questions that we anticipate, and there's a much more extensive list of those that you can access on the website. We'll talk about some of the resources and details and updated communication we have in relation to this plan. And then our success criteria is this. We want to be transparent. We want our families to feel like they have a clear picture. When we have a clear picture and clear information, we want to make sure that we're able to convey that to you in a very clear way and an effective manner with good communication. So health and wellness, obviously, of everybody involved, our staff and our students, is a major criteria for success and central to this plan as our #1 priority. And student learning obviously is our purpose and why we're here. So that is also a huge criteria for success. As we've talked about this, and I'll go through this quickly, really our why. It's important for us to think about what is our purpose of schools as we work towards reopening under these circumstances. But our mission to open the door to each child's future is unchanged by this pandemic virus. That is still what our job is. That is what our charge is. And we are going to endeavor to meet that mission under any circumstances. So our purpose we still view is to prepare our students so that they graduate college and career ready. The values that we have in this school system remain being passionate about academic excellence, that we're committed to fostering positive student citizenship, and our dedication remains to inspire each and every student to flourish and meet their potential. The way that we function as an organization, it is deep in our culture, is that we use continuous improvement practices and systems approaches to leadership and planning, and we've leaned heavily on those as we work to develop our plans. These things should sound familiar to you if we've been effective in our communication, but whenever I've communicated on this, I've talked about our guiding values as we try to make these difficult decisions. So the health and safety of students and staff, the social and emotional health of students and our staff and student learning are the values, they are the priorities that we're working on as we develop plans. If you follow social media at all, we've used this hashtag starting in the spring, hashtag #TogetherPSD. And I really want to make a statement that we are going to work extremely hard as a school system, but we don't own the success of this school year on our own. We will not be successful as we can be if we don't have the support of our parents and of our students and of our community. It is critical that we work together, that we support each other, that we're flexible, that we listen, that we engage in respectful dialogue as we try to solve these problems. So together, this school district will thrive, and we will get through this stronger than we were before, and we will have been much more successful as we're coming out of this and having met the needs of our kids if we truly are together as a community. Again, that "stay safe to stay open" is a slogan that the county has embraced, not just for business, but now as school districts, and I think it's really appropriate and descriptive of the plan that we have in place. And I thought this quote from Helen Keller was really appropriate, that alone we can do so little, but together we can do so much. So here's the timeline. Much has been accomplished already. As I said, once we switch from getting through the closure and delivering a remote instruction to students for about 3.5 months in the spring, which had to happen on really no notice, we immediately turned the page to planning for the fall. So throughout this summer, there is a continuous planning process that is in place. We have a structure that exists at the district and at the building levels with ongoing planning efforts that are continuously updated, modified, and improved as we work. We began surveying our staff on June 15th to try to identify their thoughts and dispositions in relation to returning this fall. Our first survey to parents went out June 22nd. You may recall. Recently, July 16th, we sent another survey to our staff as we tried to get clearer on willingness and desires of teachers to teach in a virtual environment. As we know, there from our first survey with parents, there's definitely demand for that. On July 27th, just this Monday, we rolled out our current plan for the fall as it sits today to our full staff. And I'm here today on July 29th, recording this to share with all parents this afternoon. So you have that information. We had made a commitment to all parents that we would be pushing this plan out by August 1st. And so I'm happy to get this out several days in front of that date. After this message is coming out with our plan, there will immediately follow another message with a survey that needs to be completed for all of your children in the district regarding trying to ascertain what your intentions are regarding the virtual versus in-person models. And I'll talk a little bit more about what those are. And I really urge people to try to complete that as soon as you can so we have that data. That will help us plan and staff and allocate resources for our open on September 1st. We're going to continue to monitor and respond to conditions throughout August. August 3rd already, next week, online registration begins. That's when you'll officially, during registration, be asked to make your selection of the learning model that you want for your child. August 26th through September 2nd will be Great Start conferences. This is not new. This is something that we've been doing for years. So those will continue. So Great Start conferences for our elementary schools run during that time. September 1st is identified as the first day for Pewaukee High School and Asa Clark to begin in phase 1, and I'll explain what that means. And then September 3rd would be the first day in our elementary schools for phase 1. Wanted to just provide a little bit of the data points from the parent survey. one of the questions that we asked, and we had 1,445 responses. So thank you for your high level of engagement and feedback with that survey. But depending on age level or building that your students attend, in September, the feeling of parents between 17% and 23% indicated being uncomfortable or extremely uncomfortable returning to school under the circumstances of the virus. Another question it asked, would you prefer a virtual learning option to an in-person option? And at that time, depending on school, ranged between 9 and 12% of families indicated they prefer a virtual learning option. We know a month ago, a month is a long time under these circumstances, and that's why it's really important we get another survey out, which will be much more targeted, and it will capture your name. It'll ask you by student what you're thinking at this time, so that we can be much more targeted in our planning with that information. So top factors that were indicated, many factors were identified as things that would help people feel more comfortable, but these were the top 4. Making sure that our environments are clean and sanitized, that we're following public health guidelines, that we implement strategies like symptom checks for staff and students, and that we employ social distancing strategies. I just wanted to share this graphic because it shows how we're organized. And this was something that was, this was a framework that we designed to manage this work. So we created a planning, a variety of planning teams. I lead the governance team, and it's the job of that team to kind of oversee the overall planning that is to take place across the district. Then we have targeted groups in the areas of school operations, instruction, wellness, which includes medical staff, our physician who's our medical advisor, the nurses in our system, among other student services staff, and our director of HR. Facilities team, and a technology team. We also have a pandemic response team that is meant to be that decision-making group as conditions change and help make decisions a little bit more rapidly. So I wanted to share how we are organized to make sure that our planning is done well and comprehensively. So let's get to the plan. That's probably the part that you want to hear about. So I'm going to share what's Plan A today, because it is July 29th, and things may look different on September 1st. But as of July 29th, 2020, our intention is to run with Plan A. Plan A provides 2 options for parents to select from for your student. One includes a soft open strategy, which is really based on an in-person instruction model. That will bring students back to campus through a series of phases to full attendance and instruction in person. So I'm going to talk in more detail what that means. The other option you can choose is a virtual learning option. We call it the virtual opt-in, which will involve a 9-week commitment in which you would be asking us to place your student in a purely virtual remote learning environment, and they would receive all instruction off-site. Students who are in the in-person instruction model will receive emergency remote instruction if there are reasons that they can't be at school under a pandemic virus. That may include things like quarantine or infection that would have kids off-site for a period of time, or any other illness may keep them for a number of days. And so when we talk about emergency remote instruction, that is for those students that are here in person, but when they're not, we would continue using virtual methods and online tools to keep them engaged. Whenever students or staff are on campus, we will be employing substantial social distancing and mitigation strategies that will be in place campus-wide. Those will include the use of personal protective equipment, cohorting approaches, K through 8, and modified scheduling. And we'll talk a little bit about how that cohorting works and what modified scheduling looks like. And again, these things are going to be broken out in detail in the full reopen plan, which you can find on the website. You'll see over to the right-hand side, phased out, something that says Plan B. And due to the fluidity of the situation, we may have to go to a full virtual option, which we are referring to as Phase 0. So again, our goal is to provide an in-person option, which we'll describe a little bit more about what that Phase 1 looks like. But if conditions require, we do have an option to move to fully virtual, depending on the spread of virus in the community. This icon down here that says reopening plan, that is available on the website, which provides the detailed planning of our educational delivery model by school that you can access there. But I'm going to hit that with some level of detail here, but full details, you'd want to go to the website to view that. So here's what the two options look like. Virtual opt-in, as I said before, this model will be a 9-week commitment. Please understand that full virtual means that all instruction will be received off-site. We will have to dedicate staff to deliver those courses. That will be their assignment. That's why the survey is so important. And then the August 17th deadline on officially making your selection. It's also why a 9-week commitment is really important, because we can't create sections and then uncreate sections and schedule people in and out in that kind of environment. So we need to know what we're dealing with so that we can plan for it appropriately and staff for it appropriately. Again, the primary mode of delivery will be online instruction. We'll use our learning management systems, which for our youngest students leans on technology known as Seesaw, which you're probably familiar with, or Canvas for our older students. Other online tools would be used as well. Those students will follow the same curriculum as their in-person peers, and they'll be assessed and graded by their progress on standards from those courses. One caveat to that, there will be some elective courses at the middle and the high school that aren't really conducive to delivery through a virtual model. So families choosing that virtual model may have to do some rescheduling, may have to select from a more limited set of elective courses. In-person hybrid, and so this model is what involves physical attendance to campus as a component. This is designed on a continuum of phases with the goal of moving us towards full student attendance over a period of time. And that will be driven by the data and the trends in terms of community health, how well the model is being implemented. Are we seeing infections jump up in our school as we return? If things go well, it is our goal, as soon as is reasonably possible, to continue to move through these phases and get to full attendance. So it's called in-person hybrid because it will include a combination of in-person and remote learning. So there'll be times in the week where students are home receiving their instruction through online virtual approaches, and there will be times when they're physically on campus receiving face-to-face instruction. So what do those phases look like? I've been mentioning these phases. Let me walk you through that. The first thing I'd like to do is draw your attention to the green box around phase 1, and again, emphasize that is our intention on September 1st to start in phase 1. Phase 0 that you see to the left is our plan B option, that if infections are at a point where we need to make that decision, that is part of the overall flexible nature of this plan. And it is an option that, if need be, we would utilize. In each of these phases, virus mitigation protocols will be implemented. Detailed plans per school are published on our Pewaukee School District Stay Safe to Stay Open webpage. But phase 1, what that looks like as a general sense, and you'll, again, if you go to your specific school-based plans on the website, you'll get more details by those schools. But it will reduce the percentage of students in attendance by 50% on any given day. On a 5-day week, this would include a Monday, Tuesday, Thursday, Friday in-person attendance that will be split in half by alphabet by last name. If you happen to be in a family where there are children living there who have different last names, you can work with your school and they'll make sure that they get to attend on the same day, so you're not splitting time on different days with those kids. In those 5-day weeks, Wednesdays, all students would learn virtually. And so this provides some additional separation of students, reduced exposure of students to each other and to staff. So it helps with that distancing and exposure aspect. It provides substantial time for custodial staff to do deep cleaning of buildings. So that is some of the rationale for Wednesdays as a virtual day for all students. Again, phase one, if things go well, and if they go really well, it could be a matter of weeks, 2-3 weeks would be our most ideal situation that we would be able to segue to phase two. The other piece I'd like to emphasize about having partial attendance, there's going to be quite a bit in terms of protocols and routines that students and staff are going to be confronted with for the first time. We're going to have to teach those to kids. We're going to have to acclimate to those kinds of practices. Some things are going to work fine, some things maybe won't. We're going to learn from that and refine those. So we're going to be far more productive and successful, we believe, if we have fewer students all at once. But again, our hope is that things go well, and then we move to phase two, which would have full attendance Monday, Tuesday, Thursday, Friday, in all 4 of our schools. In phase two, PHS and Asa Clark, those students would remain home on Wednesdays. We would consider whether or not we would move the elementaries to full 5 days attendance at that time. Again, if things are going really well, we would look to do that. We do know that the science that exists right now says that the younger age students have the lowest rates of infection and the lowest evidence that they spread virus. So there's rationale for returning the younger students sooner. And we know there are practical issues with families, that students that are of elementary age can't be left at home without parental supervision. We certainly recognize that that is a burden for families. So if possible, we would look to move those elementaries to 5 full days in phase two. So whereas the high school and the middle school would continue to be virtual only on Wednesdays, again, providing more opportunities for deep cleaning of buildings at those levels, and to allow for a reduction in exposure. I will note that in the month of July, the fastest growing age group for rate of infection has been that 10 to 19-year-old age group. So that is a group that is of bigger concern presently with the data that exists out there. Again, we move into phase two, and as things progress and they're going well, we'll monitor the data and how things are moving and progressing. And things going well, then we'll move into phase three, which would be 5 days of full attendance for all students. And again, our goal is to get there as soon as we can when it's reasonably safe to do so. I would point out that any of those phases could be employed at any point in the school year. That is not a one-way trip up to phase three. If things are going well and we're able to get to full attendance and things get worse in terms of transmission of the virus, we would very much consider moving back down to lower phases, whether that be phase 2, 3, or 0 if necessary. So the soft open plan is articulated here, which outlines really how that plan works. You can see for PLE and Horizon Elementary a little bit different because they have the Great Start conferences, which has them coming in person a couple of days after the middle school and the high school. So you would see how that alphabet A through K in-person learning takes place September 3rd, 8th, and 9th for students, where cohort B, which is alpha L through Z, would receive their blended learning in a virtual setting. And then you'd see the flip on September 4th, 10th, and 11th in terms of how students were divided, who would be attending in person, which students by last name would be receiving the blended learning or in that virtual setting. So starting September 14th, it says if needed, because if things go extremely well, maybe we would be back, we'd be moved up to phase 2, but otherwise we would move to that 5-day model that we discussed earlier. Keep in mind that those first 2 weeks of school are 4-day weeks, with September 1st being on a Tuesday, and in the second week we have Labor Day off that Monday. So we don't have those Wednesdays off in that first week, so the schedule's a little bit different. Again, all of this is provided to you on that website with detailed plans and schedules for each of your schools. You can see Asa Clark in the high school, again, articulating how that A through K alphabet, those students would be in person learning with their teacher, whereas the other students would be in that blended learning, the weeks with Wednesdays, those 5-day weeks. Both groups would then be off on Wednesday, off meaning they wouldn't be at school, they would be learning virtually. And then again, Thursday, Friday, we have the reverse where cohort B, which is that L through Z group, would attend in person, and cohort A, which is A through K, would engage in virtual learning activities. So that's how that soft open phase 1 looks on a given week. So when we consider these phases, how will the district make decisions to move to different phases? Here are the criteria that we will consider when determining whether to move to more restrictive or less restrictive phases during the year. So there's external and internal metrics that will be monitored. We look at those already every day in terms of the Waukesha County dashboard and the State Department of Health Services data. Those are things that you can view yourself and look at the rates of infection and hospitalizations and all of those kinds of things. Internally, we'll be closely monitoring student and staff attendance, student and staff absences due to COVID or flu-like symptoms. That's something if you can anticipate, if you call your child in sick, you'll have some questions to answer so that we can ask about symptoms they may be having. It's important that, again, this is one of those opportunities to help us manage this situation with divulging those symptoms so that we can really monitor what might be causing absences and might help us make decisions. The number of students or staff that may be in quarantine that have been exposed to COVID-19. We'll talk about what quarantine looks like and the county's role in that. If we've had positive cases in a cohort, school, or the district, and the number of those would be metrics that we will be monitoring. We have to staff our buildings. So we've already talked about staff attendance, but also the availability of substitute staff to be able to fill openings as we have staff members that would be out for infection, quarantine, or other reasons. And then, of course, any other guidance we receive from public health, healthcare, and the Department of Public Instruction as we move through this situation. All right, so I'm going to give an overview of some of the virus mitigation pieces that you can expect your student to experience, or as a parent that you may experience yourself in some situations. There's more detail than what I'm providing here, but I'm giving you a general sense of the things that are in place. Again, finer details are available on the website, and we'll be constantly adding more information to those categories on that website. So first and foremost, all of our staff will be provided personal protective equipment, including masks and face shields. All of our staff will be required to wear a face covering when working less than 6 feet from others. As developmentally appropriate, our students will also be expected to wear a face covering, which is what is really necessary to prevent spread when social distancing is not practical, which is often the case in schools. Please understand that schools are designed to be places that bring large groups of people together. And what we're trying to do is run schools and spread people apart to keep them safe. So mask wearing is a critical strategy, and we'll talk a little bit more about that. There may be rare circumstances when medical exemptions are necessary for students. We will work with families when that is the case. This would certainly require documentation from a physician, and the school would work with families in those on a case-by-case decision in partnership with the family and your physician to create a safety plan if wearing a face covering is an issue. All PSD staff and students will be expected to monitor for COVID-19 symptoms. Parents, I can't stress this enough, how critical it is that you help us with monitoring symptoms for your children and that they remain at home if they are symptomatic. If students become symptomatic at school, our process will be to isolate them, mask them, isolate them, and send them home for a minimum of 72 hours. And there will be a symptoms checklist included on our website that will be available on the PSD Stay Safe to Stay Open website, as well as through online registration. We'll be engaged in enhanced hygiene, sanitation, and health room procedures that they will be implemented in all school settings. Face coverings is obviously a volatile issue. I've talked to many of you who have strong opinions on both sides of this issue. Um, so here's how we approach planning, and here's how we approach making this challenging and difficult decision, because we know the strong feelings that people have about this particular topic. What we need to do is we need to look at the best guidance we can get from the most credible organizations. So the guidance that we've received from the Centers of Disease Control, the Department of Health Services, the Department of Public Instruction, the American Academy of Pediatrics, Children's Hospital, the Waukesha County Health Department, and the Waukesha County Executive, all of those organizations emphasize the use of face coverings as an important requirement in schools when implementing in-person learning. So we will have a requirement. We are certainly going to work with students to be as reasonable as we can, to look for opportunities for mask breaks, to consider the developmental level of students. There's a difference between a 4-year-old's willingness and ability to wear a face covering and that of an 18-year-old who's a young adult. I want to share this statement published today by Waukesha County's Division of Public Health. It was also emphasized by County Executive Farrow in his comments today at the press conference, but they urge public and private schools and school districts considering in-person schooling to require all students and all staff to wear a face covering when at school or while participating in school activities. It has been conveyed to us that on average, when everyone wears a face covering, it reduces transmission of virus by upwards of 80%. And I have had some questions about, well, if one person's concerned about getting the virus, can't they just wear a mask and I don't have to? And that is not how this works. That kind of reduction in spread is a result of both people wearing a mask. So that's something we really need support from families on. Certainly understand that all of us would prefer not to be wearing masks, but this is the kind of thing that's going to be necessary if we're going to open our schools and to keep them open. Mitigation strategies, more information. There will be significant limitations to any visitors coming to our school. So that will be limited. If it's absolutely necessary for a visitor to be in our building, they will be required to wear a face covering at all times. Student pickup and drop off, there will be specific procedures communicated by each school, but they will be designed to reduce or eliminate the need for non-school staff or students to enter any of the buildings. Volunteering will be limited to virtual or non-school hour opportunities. Field trips will not be allowed until further notice. Rare exceptions may be made with administrative approval for essential curriculum delivery. We'll be looking for virtual experiences for students to engage in some of that kind of learning that is often helped by field trips. Any kind of meetings, all meetings will be held virtually unless it's determined necessary to meet in person. And if so, social distancing and face coverings will be utilized. So this includes parent conferences, IEP team meetings, and any other meetings that we may have. What happens if there is a positive case at school? Parents will be promptly notified whenever their student may have been exposed to a known case of COVID-19. The district will work in partnership with Waukesha County Health Department and their contact tracing team. We were informed today that they've tripled the staff involved with contact tracing. And the county owns the primary responsibility for contact tracing and making determinations regarding quarantine. We'll certainly work in partnership with them to streamline that communication. The more quickly and effectively you're able to contact trace, the more effective that process is in containing spread. Throughout the course of the year, individuals, groups, class sections, grade levels, schools, or the full district may experience some level of quarantine or a shift to more restrictive phases in response to positive cases. So this goes to what I mentioned earlier about that we may move up or down those phases depending on the conditions that exist with the virus. But it is not necessarily the case that we will close a school because there's a positive case. We may have a class section that is sent home for a number of days. It could be a grade level. It could be one of our 4 buildings. It could be the entire campus, depending on the circumstances. So we're going to think more flexibly, and we'll be consulting with the county on making those kinds of decisions. In general, what are the quarantining procedures? And you can find these on the DHS site. You can find these clearly articulated on the Centers for Disease Control site. But the basic pieces to remember are 6 feet, 15 minutes, and 14 days. Those are kind of the key numbers. So if there is a positive case in the environment that happens, what we'll engage is the contact tracing team will interview the individual that's positive. Anybody that's discovered who's been within 6 feet for greater than 15 minutes up to 2 days prior to the presentation of symptoms will be quarantined for 14 days by order of the health department. So when we talk about things like cohorting, and I used that term before, cohorting are strategies that are designed to limit the circle that you are interacting with. So when we use cohorting strategies in our schools, that means we implement specific strategies to have less interaction from different classes and grades and students, whether that be having limitations on who they might interact with at lunch or the kind of cross interaction that might typically happen in recess. So very specific cohorting strategies to bring those numbers down. And I'll talk a little bit about some of the methods used in the different buildings. School operations, a couple of things of note. Transportation, multiple strategies will be implemented to reduce exposure on buses. And there will be a survey question in the survey that comes out about your intention on having your child ride the bus. But we have determined with our partner at Right Way Busing that we are able to run separate bus runs for both PLE and Horizon. This will allow us to immediately bring down the number of kids on those buses so that we can spread them out more and reduce exposure. Every student riding a bus will be required to wear a face covering. That's a very tight environment that's difficult to distance kids, so face coverings will be very important. We will have assigned seating. We'll load buses from back to front, and then we'll unload buses from front to back. That'll be done so that you don't have kind of that cross traffic, which increases interaction. We are encouraging parent pickup and drop off when feasible. We do have redesigned physical parking lot and traffic situation up here on campus due to construction, which we think will help to some degree with that. But that is definitely an option that can be helpful if fewer kids ride the bus. We have more spacing, and that helps with this. And we are contracting with Right Way to have enhanced cleaning between routes so that there are cleaning that happens between every route, and then complete full nightly sanitation of all of our buses will happen throughout this year. Food service, again, every school will have its own plans. But here's the broad strokes of what those plans will include, involving multiple strategies. Every school will develop a plan in partnership with food service. They'll be looking to enhance social distancing, hygiene, sanitation, and prevent contamination. Lunch schedules, locations, and seating arrangements will be modified to limit exposure and implement distancing strategies. Kids will be clustered by cohorts, again, so they're not intermingling with other sections during the school day because, again, that increases exposure. Food service will eliminate common source kinds of options, salad bars, common use condiments, those kinds of things, because those are much more conducive to virus spread. Throughout our facilities, we have extra safety protocols that are being implemented. Buildings will be cleaned and sanitized daily and nightly with CDC approved products. We'll have extra staffing, in particular during the school day, to be hitting those high touch surfaces for additional cleaning. Hand sanitizer will be available in every classroom, the main entrance, the cafeteria. We have many classrooms that have sinks in them, especially at PLE. Our new classrooms certainly all do. And I would emphasize that hand washing, thorough hand washing, is viewed as superior to uses of hand sanitizer. Hand sanitizer is a good fallback, but hand washing is more effective. Wherever we can, things like doors will be kept open to the extent possible and safe so that we're not touching those surfaces, so that'll be done strategically. We've already talked about limited visitor access to buildings. Any kind of subcontractors that need to be in, we'll have specific protocols with them. On those off days on Wednesdays, we'll engage in deeper cleaning of our facilities. We have areas that will be strategically fitted with plexiglass. If you come into any main offices, if it's necessary to do so. In reception, for example, those will have plexiglass. Our library circulation desks would be another example. There would be some use in classrooms. So that is a strategy that's being implemented. Air handling units, bringing in fresh outdoor air, which is mixed with recirculated air and filtered. So how we're using HVAC to improve circulation is a component. So that's a piece. Masks we've talked about. Social distancing we've talked about. It's going to be implemented wherever possible. We will turn off the water fountains, but the water bottle fill stations will remain turned on. So families keep that in mind, that your child will want to be bringing their own water bottle to school. They'll be able to fill that, but water fountains will not otherwise be functioning. Instruction, I'm giving you a very general overview here, and would direct you to the reopening plan, and you can see the cover of that, of what that looks like on the right. That's available under the instructional model section on our PSD Stay Safe to Stay Open website. But it's really been the goal of the instruction team to develop a really flexible system for curriculum and instruction that helps our teachers be prepared for these various learning environments that we're talking about. Expectations have been developed, professional development and training has been designed and is already being deployed, and how we're deploying the kinds of resources, technology and otherwise that teachers need to support that kind of instruction. So those pieces are in place. Linked here is a resource page that includes resources for students and parents, which is available again on our PSD Stay Safe to Stay Open website. For parents, the students with special education or 504 plans, IEP teams, 504 teams, and evaluations for 504 special education accommodations, those things will largely be handled virtually unless it's impractical to do so. Teams will be working with each family to adjust plans according to those new learning environments that we have planned for the upcoming year. Parents, we would direct you towards your case manager as your primary touch point for communication. Our Director of Student Services, Mr. Stranke, is available and accessible to any parent who has specific questions that he might be able to respond to. Emphasize the access to student services team if you have concerns, mental health or otherwise, anxiety, those kinds of things that you feel your child will need support. We certainly encourage you to reach out to your child's counselors, our school psychologist, our social worker, or Mr. Woodford, our student assistance coordinator. They are there to help in those situations. A quick note on athletics and activities, and there will be a little bit more detail from Mr. Behrens on the website about this. But this is kind of where athletics stand right now. We're monitoring and collaborating. Collaborating with the WIAA, with the Woodland Conference, with directors in our region, and paying attention to what's happening throughout the state. It is our belief that these kinds of things are a very important component of a student's experience, and certainly our goal as a district to provide those experiences to students if it's safe to do so. And some activities are safer than others and may be easier to provide for than others. Currently, all of our fall athletics programs, or most of those, have had the start of their seasons already delayed. Our athletics department has established a very detailed and tiered plan for training. We implemented that this summer for summer contact hours, and it's been pretty successful, but it definitely places limitations and restrictions on things that have been done traditionally. The tiers of that plan that we engage at any given time are determined by the risk that exists in the community in terms of transmission of virus. And things went pretty well in June, but not so good here in July. So things have certainly tightened up. But we'll continue to monitor conditions and provide updated information to families in the days and weeks to come. Technology. It's a little bit of the lifeline that we have in this process when students are ever learning from home, but it's also very important when kids are in school. So our technology team is very focused on making sure that we have an equitable distribution of devices, as well as making sure that all families have connectivity so that they can engage in learning this year. So here's some of the action steps that have taken place. We've moved from a 7-12 take-home model with one-to-one Chromebooks to a second grade through 12th grade one-to-one take-home model. So devices will be able to go back and forth from home with kids as young as second grade. And that is, again, a new experience for kids in grades 2 through 6. In our youngest grades, 4K through 1, we will work with families who may need support with devices at home, where we would deploy a Chromebook so that that would stay at home, so that when technology is needed, there is a device that is web enabled in your home. So communication with PLE will be important on that, as well as with our technology department. We've referenced before our learning management systems. We use Canvas in grades 5 through 12, and we use Seesaw in grades 4K through 4. Many of you have experience with those, and our teachers are trained in using those. They will be a really important tool, organizational tool in structuring any kind of online virtual learning. There will be digital tutorials and a resource parent-facing site. We'll be placing an emphasis on digital citizenship, and there will be a newly developed, we had one in the spring, but we're retooling a parent-student help desk and phone support line that was effective in the spring. So we'll be communicating that information and that phone number out to families. So again, I want to just kind of bring us back to our plan. To reiterate, Plan A is our direction, where we are offering 2 choices. You have a choice, if you're most comfortable, to opt your child into a fully virtual learning environment. Again, that is a 9-week commitment. You would have an opportunity after 9 weeks to remain in that environment or to segue back to the in-person environment. Likewise, parents with students in the in-person environment at 9 weeks would have the opportunity to request virtual as your option. The in-person hybrid model will engage a soft open strategy so that we phase our way up to full instruction. And again, it's our goal to get students to a full attendance situation here at school. And I really want to emphasize, we want your kids here. We are desperate to have students back on this campus. We miss the kids. We have new facilities. We want to see them full of students. So I just want to make it really clear that as a staff, we're really anxious to have your children back and look forward to that. So we have to do it safely. We have to work together on that, but that is very much our goal. I've talked about emergency remote instruction for kids who may be in and out due to quarantine infection or other illness. I talked quite a bit about the social distancing and mitigation strategies that we will be implementing, and that the enhanced sanitation and cleaning procedures. We talked about Plan B, if infections are at a point where we feel we have to make that decision, that it's just not safe to return to school, that is something that would have to be considered. So what's your to-do list? So I would urge you to go to the website and get more information than I've provided here. This again was meant to be an overview. I'm sure this has probably generated as many questions maybe as it's answered. I'm confident that many of your questions will be answered with the information on that website. So if you go to the Learning Models tab that's on that site, you will find the fully articulated plan, and you'll be able to go right to your kid's school and see with more specificity what the plan in a particular building looks like. There is a frequently asked questions tab that tries to consider and may answer many of the questions that you have. This video will be linked there if you want to review it and fast forward to lots of the stuff you don't want to listen to me say again. For details, please take that survey that's coming your way so that we have the best information we can to begin planning, knowing that over the next couple of weeks you're going to have to make your formal decision as you kind of digest all of this and think about what environment you want your child to be in. And again, like us, you're probably monitoring the data that exists in our community with the virus. Ask questions. There is a lot to cover. Our goal of this was try to make a really complex and detailed plan digestible and understandable. In this short time, I've already thrown an awful lot at you to consider, but certainly ask questions. And I'm going to provide a slide here that kind of gives you some guidance on who to direct your questions to. There's times where your child's principal is appropriate. I'm available for any questions, but we'll talk about who might be the best people. But we really implore you to help us be more efficient and responsive by first looking to the website, try to get your own questions answered with the information that we've already provided for you, and then reach out directly to the appropriate people with any questions you have. I don't want you to hesitate to do so if you don't have those answers. I would also note that we do not intend to be answering any questions that might be posted on social media. If you want legitimate answers to your questions, again, we would ask you to contact us directly. Online registration then opens on August 3rd, and you have a deadline of having to register and select that virtual opt-in by no later than August 17th. If you don't select that option by August 17th, by default, your child would be enrolled into the you still need to complete online registration, but we would assume your child is going to be in the in-person mode. When can you next expect more communication? We will continually be updating the information on our PSD Stay Safe to Stay Home webpage, or Stay Safe to Stay Open webpage, rather. So be checking back there for the most current information. We're planning that each school will host an interactive webinar in mid-August to review updated plans and provide an opportunity for Q&A. So be watching for that. After a couple weeks in August, we're getting real close to the school year. We'll have even more information. We want to get those revised plans out to everybody and provide people with an opportunity to ask questions. Again, I want to emphasize how important it is that we stay together. I want to close a little bit with this quote from Maya Angelou: do the best you can until you know better. Then when you know better, do better. And that's our commitment. This is new for everybody. I've been in education a long time, never experienced this, nor has anybody else. And so we're getting the best information we can, putting the best plans in place that we can to try to figure this out. So we're in this all the way with our families. We ask you to support us as well. If we keep working together, I know we're going to have a successful year. Lastly, with questions, there is an FAQ tab on the website. I would ask you to review those questions as you have them to see if maybe there's a response to a question that you may have. There's also an opportunity on that FAQ site where you can submit your own question that maybe others can benefit from. We will answer that question, and if appropriate, we will post that question and add it to our list for public viewing. As I said, you are always welcome to contact me with any questions or concerns. To expedite things, if you have something specific to instruction or curriculum, I would contact Danielle Bosonic. If you have questions regarding operations, and that would be food service, that would be really things facility related, busing, those things, John Gann, our CFO, would be your best contact. Anything with health, wellness, health room protocols, nursing services, all of those kinds of things, our Director of Human Resources, Colin Jacobs, is your best go-to. Anything related to technology, our Chief Information Technology Officer, Rachel Yerk, is your best go-to. Anything special ed, student services, 504, mental health related, Mr. Stranke, Anthony Stranke, is your go-to. Anything specific to a particular school, go to your principal, and those emails for our 4 principals are listed. And if it's specific to questions about athletics and activities, our athletic director, Jeff Behrens, is your best contact. So again, a lot of information. Thank you for listening and for your attention. Again, this is our best effort at this time, and we're going to continue to try to make it better. And if you have questions that we have not answered, please don't hesitate to contact us. We hope everybody is well. We hope your family is healthy, and we look forward to seeing students in about a month.